Hello and welcome to another episode of A Conversation with Villa Springfield. And I am here with Dr. Neravetla, Soumya, daughter of the Dr. Neravetla, which she gets a lot, right?
I often call myself the other Neravetla.
The other, I just say the younger Neravetla. Tell us a little bit about yourself and about the practice and what you got going on.
Sure. So the practice was obviously started with the original Neravetla, my father. He and Dr. Missick started the cardiac programs originally actually both in Mercy and community. And the practice has been continuing since he started it. He's still in practice. I get that question a lot. Is your father still practicing? Absolutely. In fact, he was in office seeing patients just before we started filming this. So I grew up here in Springfield. I was actually a North High valedictorian back in the day. And I've been gone from Springfield basically since high school until recently. I went to Florida and did my CT surgery training there. And I actually did a robotic thoracic surgery fellowship in South Miami, which was a specialized training in robotic surgery. And then after that, I actually did another specialized advanced fellowship in Emory in Atlanta. And after all that training, which was a long, long time, I actually went to Savannah and I started a structural heart program there and a transcatheter valve program and a robotic thoracic surgery program there as well. And then when Dr. Missick left, my father invited me to come back home. And so I've been here since Dr. Missick left. It's been over 4 years, believe it or not.
Has it really?
Yes.
Wow.
Well, it was supposed to just be a few months.
Exactly. Everybody's like, is she staying? Is she going?
4 years later, we're still here and brought some of those same advances here to our community. So it was a dream of mine to bring the transcatheter valve technology back to Springfield. That was a little bit of a long-term project, but definitely were able to get started with the lung cancer screening pretty soon after I arrived and got that program up and running, and we've definitely made some progress there. And just focusing on more minimally invasive, whether it's vascular or cardiac surgery or thoracic surgery, trying to bring some of those less invasive advanced techniques to this community.
And we appreciate it. We're glad you're back. The cardiac program that your dad started and that you're in and your practice is in, lots of awards.
Absolutely.
Lots of things. I don't even think the Springfield community realizes what a gem we have right here in our community. There's no reason to go out of town for cardiac care at all.
Absolutely, yes. The cardiac surgery program here in this community has won more awards than I believe any other program in the state of Ohio. Yes. Just because we've had so many different awards, and we consistently get what's called the 3-star award from STS. And 3-star may not sound like a lot because we're used to comparing things on a 5-star basis.
5-star, yes.
But 3-star is actually the highest rating that only about the top 10% of programs in the country get. And we have consistently gotten that award year after year after year. So there's very few programs who get that award so consistently. But on top of that, we've gotten awards from just about every insurance company out there. Consumer Reports even gave us an award for being in the top 10 in the Midwest region. And,
that's great.
And to you and me, I think typically we think of a tri-state area as the Midwest region.
Right.
But what's really interesting is the Consumer Reports actually included a large 14-state region in their Midwest region. So it makes that even more impressive.
It sure does. And you have the tools here. Mm-hmm. You have the robotic tools. You have all those things at your fingertips, literally.
Yes, yes. We have the advanced bronchoscopy tools as well, so patients have access to some newer techniques for biopsy when it comes to lung cancer. We're doing the transcatheter valve stuff for valve replacements here. We do all the less invasive stuff for if you've got blockages in the arteries to your legs. We basically, there's very few things that we can't take care of here. And it's a lot more comfortable being right here at home as opposed to
it is.
Going to some facility where,
it's not familiar.
Mm-hmm.
and you don't know anybody that works there or
Right.
anything, it can be scary,
Right.
especially during a pandemic when if you're going, you're alone.
Exactly, yes.
So that's bad. It's Lung Cancer Awareness Month,
Yes, it is.
and I know you've been on a crusade with that, and
Yes.
and I have. There's been a whole group of us that's been trying to spread the word. Let's talk about that a little bit.
Absolutely, and I'm wearing my white in honor of Lung
Yes.
Cancer Awareness Month. So lung cancer is the #1 cancer killer in the U.S., amongst men, amongst women. A lot of people don't realize that. We think of breast cancer or even colon cancer more commonly.
Right.
But the reality is that lung cancer kills more people than breast, colon, and prostate cancer combined. So it's a big, big problem.
That's huge.
It's
I mean, think about that.
Huge. It really is.
Mhm.
It's ginormous. When you look at like the pie charts and all those things, it's unbelievable how big of a problem it is
Mhm.
and how little we talk about it.
Well, and do you think part of the reason we don't talk about it is the stigma that goes along with lung cancer?
Absolutely.
Unfortunately.
Absolutely. And that's part of what my crusade is about, is to try to destigmatize it, try to put the bad PR where it belongs. And the bad PR
Right.
is the lung cancer. The villain of the story is lung cancer. And we need to stop blaming the patients and start realizing that they're victims and that they're not the ones that should be blamed for this. And we need to support them just like we support breast cancer patients.
Right. And tell them the little analogy that you have when you talk to your friend and...
Yes. So for anyone who's been to one of my many talks, there's a cartoon that I always have in my lung cancer talks, and it has a friend who informs her friend that she has breast cancer. And the friend says, I'm so sorry, I'm going to buy a pink ribbon and donate $5 to the Pink Ribbon Fund. And mentally thinks, I feel so sorry for her.
Right. What can I do for her?
Yeah, what can I do for her? Then there's the same friend that tells her same friend that she has lung cancer. And instead the response is, did you smoke?
Mhm.
And mentally thinks, well, she did this to herself.
Right. Like you deserve it.
Exactly.
Nobody deserves it.
Exactly. So at the end of the day, I think we just have to remember that nobody deserves cancer. It doesn't matter, what risky behavior you undertook, and I'm not trying to condone or support people in continuing smoking, of course.
Right,
More
right.
than anyone, I would love for people to quit smoking, and I spend a lot of time, my patients will tell you, all the time trying to get them to quit smoking. But at the end of the day, that is, the punishment far
Mhm.
outweighs, the crime. And just like it wasn't okay for us to blame AIDS patients,
Exactly.
it's not okay for us to blame lung cancer patients.
And I think with lung cancer, when you hear that, you think immediately death sentence.
Mm-hmm.
But things have come a long way, haven't
Things
they?
have come a long way. And I recently narrated something called the lung cancer story, and it kind of goes through this whole story of lung cancer and kind of changes that whole paradigm of how we, instead of treating the patients as the villains, we treat lung cancer as the villain,
Mhm.
but also, how much progress we've made. And there's a team of shiny knights, and those knights include all those advances that we've made. So we have the advances in surgery, which we alluded to with the robotic surgery. We have the advances in radiation with what we call, what is often called radiosurgery for people who aren't surgical candidates. And I think the one that everyone's probably familiar with or has seen a commercial about is all the advances with chemotherapy.
Yes.
With these advanced immunotherapy and targeted therapy options, which have really made a difference in patients who have later stages of disease. But the other advances that we've made, and which I have referred to as Excalibur in this narration, is the lung cancer screen. And actually that's what the lung cancer t-shirts, the awareness t-shirts are going towards that fund, is to help patients who can't afford to get screened get
Mhm.
screened. But that's a really nice tool that allows us to catch lung cancer early. And when we catch cancer early, we have a much better chance of a better outcome of survival and all those good prognostic indicators. And when we compare a lung cancer screen to other screening like a mammogram or a colonoscopy, it's really simple. It's painless, there's no IV, there's no contrast, it takes less than a minute, it's covered by insurance most of the time, if in the vast majority of cases, if you meet the criteria for needing to be screened. So really there's no excuses.
Not to have it,
exactly. I mean, if you're gonna, nag your grandmother about getting her mammogram,
Right.
then, if grandma's a smoker, you need to talk to her about getting screened as well.
And that's something they can have a conversation with their primary care doc too.
Absolutely.
And I know you've made great strides in communicating that to primary care doctors and the importance of it. And I feel like I've seen a lot more of them on board with
Yes.
recommending it or...
Yes, absolutely. Compared to, when I first arrived in town, we didn't even have a lung cancer screening program at that time.
Nope.
So we, and I have to, appreciate the work that Mercy Health has done and joining me in that campaign. And Pilar also in being a champion, Kevin Griggs, the radiation department, the radiology department, have all helped really bring that vision to light. But in doing so, we went from doing 0 screens, or there was a few screens where patients would go and pay out of pocket to
have it done.
it done in Dayton. And it was not covered by insurance the way their program was set up. So this was a program that was designed to be covered by insurance. Compared to the 0 that we were 4 years ago, we've definitely made a lot of progress.
That's great. And it's basically a CAT scan, right? Is that what it is?
Yep. It's a CAT scan that is a low-dose CAT scan.
Okay.
So what that means is that you get less radiation from the scan, but you still get a lot of information from the scan. So we see a lot more than we did with a regular chest X-ray, without all the radiation that you get with a regular CAT scan that you might get if you go to the ER with shortness of breath, for example.
And like you said, it only takes a minute.
Yep, less than a minute.
To have it done. Well, let's talk about if you diagnose early and you find something, what's the next step?
So if you diagnose early, so if you see something on a scan, the next step is usually some kind of biopsy. And so one of the options is a biopsy coming in from the outside that the radiologists usually do. But we also have the option that we do as the surgeons where we go in through the airway, and that was also some new technology that was one of the things that I worked on when I first came here, and going in through the airway and biopsying from inside. And when we do it from the inside, the risk of lung collapse is much lower. In fact, I just did a patient within the last couple weeks actually, who has a lot of emphysema and lung disease, and so the risk of lung collapse is very, very high. In fact, had gotten turned down by the radiologist because the risk of lung collapse is so high. And even I was a little bit nervous, and I said, hey, this is in a pretty risky location, plus you've got a lot of disease around it. The risk of lung collapse with this is pretty significant. But because of this technology, we were able to get good quality biopsies, and he actually didn't have a lung collapse after the procedure. So it was
great.
Pretty incredible. So we have those biopsy options to come up with the answers of what's going on. And then once we've shown that the patient does have lung cancer, if it's early stage lung cancer, we can do robotic surgery. And robotic surgery typically involves incisions that are about the size of my finger. And we have a camera, we have these instruments that have actually 540 degrees of rotation.
Wow.
So they even have more dexterity than your own
hands would,
wrist.
sure.
Yes. And so we have those instruments that allow us just a much better quality of vision, but also a better quality of precision and ability to really cleanly dissect everything. And what that allows us to do is it allows us to get all the lymph nodes that are involved around the tumor as well, which I think also has a big impact on outcomes, because if the tumor has spread from where the primary location is into some of those lymph nodes and we don't know about it, then a patient may not get the appropriate adjuvant extra treatment that they need, and then the cancer can come back.
Yeah, that makes sense.
But now this tool allows us to do such a good job with getting out all the lymph nodes, and our incisions are so small, patients really do recover much quicker than they did with the old-fashioned operations, and they're usually out of the hospital within a few days.
And if that's what they had and you were able to remove this section, would you call that a cure?
So typically, we do expect a cure with early stage lung cancer. Yeah, so the cure rate is pretty high when we catch it very early.
Now think about that. Look how far we've come.
Yes.
Lung cancer used to be, that was it.
Yes.
And
We still watch them, but
well, absolutely, but
we
still.
still keep an eye on them. But the truth is, as Michelle points out, when we do catch it early, a large number of patients are cured.
Right, and that's all due to the screening.
Mm-hmm.
You don't wait till you have symptoms.
Absolutely.
And what kind of criteria do you have to meet in order to qualify for the scan normally?
So the scan is recommended for at-risk people who would be heavy smokers or a history of heavy smoking. And that's defined by a 30-pack year history. And what that means is basically you either have smoked 1 pack per day for 30 years, or 2 packs per day for 15 years, or 3 packs per day for 10 years, or some combination
Of that.
where you calculate up to having smoked a 30-pack year in your life. And you need to be a current smoker or have quit within the last 15 years, typically age 55 and older. The upper end insurance coverage is a little bit variable, but below about 75, the insurance tends to be pretty straightforward. It's above, it's the upper end that gets a little bit, can be variable depending on the insurance. As you alluded to, you do need to be asymptomatic because if you are actually having symptoms, then you should probably get a diagnostic CT, which has that higher definition and can catch other things. And you also shouldn't have had a CT scan for some other reason in the last year, because if you had a CT scan for something else, you got hit in the chest, or you were having shortness of breath, then the expectation would be that scan would have picked up on
something there.
So we don't want people to unnecessarily be getting radiated.
Sure, right. Now, let's talk a minute about the pandemic, COVID, and your practice and the hospital. People have been very leery to even have minor procedures done or to even go to the doctor because, you feel like, oh, at doctor's office, I'm going to catch it. When in reality, it's one of the safest places to go along with the hospital.
Yes.
Precautions are taken.
Right. Yeah. So we have to, so lung cancer is actually an excellent way to point out that whole COVID story. So, and referring back to my narrative about the lung cancer story, the COVID-19 was the plot twist, right? So we had been making all this progress, and the number of people dying from lung cancer was starting to gradually come down. We're making all this headway, and the story's starting to look brighter, and then bam, COVID comes along. And because of COVID, the number of people getting diagnosed with lung cancer had dropped dramatically because people aren't going in to get screened. They're not
for anything.
They're not going in to see their doctor, just as you pointed out. And unfortunately, COVID is a battle that we have to fight. Absolutely, we have to do what we need to do for COVID. We need to be wearing our masks. We need to be, physically distancing. We need to be doing our hand washing. And just to point it out, we are not wearing masks for this because of audio purposes, but we're obviously very far apart.
Right.
And our masks.
And we have them right here.
Yes. And our masks go back on as soon as this video is done. But the point is that even though we're battling COVID on the one hand, unfortunately, all the other diseases aren't giving us a pass.
Right.
And so, your landlord may give you a pass if you're fortunate, but, heart disease, lung cancer, breast cancer, no other disease is going to be giving us a pass. And so, if you should be getting screened, if you should be going in to your doctor to check your heart out, you really do need to continue to do that, because it is important that you don't allow a life-threatening disease get untreated. And that could be what kills you instead of the COVID. And and especially now it is challenging, right? We hear all this talk about the surge, and we were almost purple a couple weeks ago, and so it is a concerning time. But it's all the more reason we just need to buckle down on our safe practices in terms of wearing masks, doing the hand hygiene. The hand hygiene is really, really important. And my hands are probably, cracked with the amount of hand sanitizer that I do on a daily basis. But we need to be vigilant about that. And we do that in the hospital. There's hand sanitizer stations everywhere. And we Unfortunately, like now when there's a surge, we have to close down visitation policy to limit the number of people who have access, to limit that exposure. But we also have our COVID patients in a separate wing where there's negative pressure rooms and they're separated and isolated from everyone. And for example, if you're going to get a lung screen, that's done at the imaging center, which is not anywhere near where the COVID patients are getting treated. Don't use COVID as an excuse to not take care of yourself in a way that you should, because it really is important to make sure that you're keeping track of your health problems and getting the screens, because early detection is such an important thing when it comes to cancer. And the other thing is when you're just even talking about routine visits to your doctor, a lot of our, doctor's offices in town, I know ours is one of them, have embraced televisits, and it can be a little bit cumbersome at times. And I know some of our patients, that is a limitation to some of our patients, that they don't have, great smartphone technology.
Sure. Or Wi-Fi even
yes,
sometimes.
And the internet is a big problem. But for those that do have it, that's a tool to use so that you get to check in with your doctor on a regular basis. But please don't hesitate to see your doctor if you have something that is a concerning issue. Now, I will say one caveat to that is if you feel like you have COVID, please don't go into your doctor's office.
Right.
That's not where you want to be. I mean, if you feel, and most doctor's offices have signs posted saying if you've got a fever or you have respiratory symptoms or cough or cold, do not pass go. Do not collect $200 and turn back around and get referred to the COVID clinic. But that is one thing. Like if you do have a suspicion that you think you might have COVID, don't go into your outpatient physician's offices, because that can actually cause the spread.
Right, and we don't need any more of that.
Right.
Well, and cardiology is just the same as lung cancer. Know your symptoms. If something seems different, don't wait.
Right. If you have chest pain, do not ignore it just because you're worried about COVID.
Right. You don't want to have something worse happen, and then you will be laid up for a while.
Right.
So what can we do as a society, since it has the negative spin on lung cancer? What if we want to donate, or what if, you see all kinds of stuff. You see the Cancer Society, you see this, you see that. And I've gotten to the point where I just donate locally where I know my dollars are going to be used.
Right.
Because there's so much out there, you just get confused.
Right.
So tell us a little bit about if we want to help, or what can we do? We can buy a t-shirt, right?
Yeah, you can. So actually right here in our office, we have some lung cancer awareness t-shirts for sale. We have the short sleeves and we have long sleeves. They're really comfortable. They're 100% cotton. And then we also have sweatshirts available for pre-order as well. So if you want a special order sweatshirt, we have those available too. And usually November is a little bit chilly. This November we've been lucky.
Right, we have.
But those are available to order as well. And all the proceeds for those shirts do go to the lung cancer fund that we have at the Mercy Health Foundation. So the Mercy Health Foundation does have a fund. So if you go to their website, or you want to write a check to the Mercy Health Foundation, and you just put memo, even if you just put memo lung, that's as simple as that, it'll go to this lung cancer fund that then helps us with all, specifically take care of the screening for patients.
Sure, or a copay maybe if they had it or something.
Yeah. So we have these screening events that we do during Lung Cancer Awareness Month, where we welcome people to walk in and get screened, even if they haven't had a prior physician order.
Right.
They can just walk in and get screened. And some of those patients may not be insured and may have to pay out of pocket, but we cover, we get this grant that helps cover all those screenings during this month, and the funding for that comes from the Mercy Health Foundation and the grants that we get from them.
That's wonderful, and I will have that information at the end of this video for people who would like to donate. I mean, $5 would help. Anything.
Yes, anything, everything makes a difference.
Right.
And then I'll also, when she has the links, I'll list a couple national ones just in case anyone's interested more in research. But if you want your money to
locally.
To have a local impact, I definitely recommend the Mercy Health Foundation Lung Cancer Fund. It's really helped us do some lung cancer awareness programs over the last couple years.
Right, that otherwise wouldn't have been able to.
Yes.
And the whole idea is just get the word out. Unfortunately, I think as humans and with technology and everything coming at us all the time, unless it's happening to you, you don't pay attention.
Right.
No matter what it is.
Right. And that's and as Michelle pointed out, it's been a crusade of mine. And so
it's a good crusade.
So and it's not just an issue here in Springfield, to be frank. And in
Right.
fact, I think we in Springfield are becoming a trendsetter for this lung cancer awareness because we built a reputation to the point that I was invited by the governor to speak about lung cancer awareness last year. And so it's actually an issue nationwide
Right.
that we make a big deal about, breast cancer awareness in October, and it's a national thing, right? NFL stars are wearing pink on their shoes.
Everybody
and
knows
their
what pink
jerseys.
means.
Yeah,
Right.
Flight attendants are wearing pink in October,
Yes.
and obviously people aren't flying as much, so it's not. But I was picking up Chiquita bananas the other day. And this was well into November, and my bananas have pink stickers on them. So we make this big deal about Breast Cancer Awareness Month, which is fantastic, by the way. We just need to learn how to do that for lung cancer. But we also tend to, talk about Heart Month a little bit in February. So we get some recognition for Heart Month. But for so many years and in so many cities, lung cancer awareness the month just kind of flew by because people are focused on elections. People are thinking about, Thanksgiving, and Black
the holidays
Friday.
coming.
It's basically this black hole between, Halloween and Thanksgiving, and it's just this vacuum where,
Right.
there wasn't any awareness happening. And we've made an effort to really change that. And I've been fortunate here that there's been a team that has joined in my passion and really doing a bunch of events. And I know last year you helped me.
I think you had one a day for the
Yeah,
entire month.
I think we had 21 events by the 20th of November that we had planned. Fortunately we didn't have to deal with COVID last year. But Michelle was worried that she was going to have to carry me out.
I did. Look, I don't know how she can talk anymore.
But the fact is, we had really, we weren't going to sit by and let lung cancer awareness go quietly and without people being
Right, or be a death sentence when you hear you have it.
Right.
Everybody needs to fight everything, no matter what stage you're in.
Right.
And like you said, with things coming along and with treatments and medication and things, and you have the same thing with heart surgery.
Right.
Things have advanced to the point where if you used to have to go out of town, you certainly do not have to now to have your surgery and the robotic surgery.
Right, yes. Yeah, we have a great program here, and we are also like a personalized program. It's your hometown,
Yep.
your family's here, and you get treated like a person. We have a select group of nurses that take care of our patients in the hospital, so we have a small specialized team, not just of us as the surgeons, but the team that supports us. They've been working with us for a while, and we work cohesively, and they are part of what helps you succeed.
Right.
Turn that off.
Well, that's all right. And that makes a difference, because if I have heart surgery and then I have to know somebody else, say, listen, so-and-so is there, and
Right.
and everybody in Springfield knows everybody or is related or somehow.
Right.
And I think being relaxed and being able to, you gotta grab it?
No, I just got it. I need it.
Being able to know somebody who you're comfortable with helps in recovery.
Right.
If you're not comfortable.
Absolutely. I think having that support is really important, and it makes a big difference, especially when we're talking about the cancer patients too. Like sometimes
Right.
they need chemotherapy or radiation, and they have to go in for multiple treatments. And if you have to drive all the way to the James to do that,
Right.
that becomes onerous, and that itself can be draining as much as the cancer is.
Sure.
And the truth of the matter is, we've actually been doing robotic thoracic surgery here longer than they've been doing it at the James, believe it or not.
Wow.
So the program here is over 10 years old. So the the boss, the original Dr. Neravetla. He started robotic thoracic surgery here well before they were doing it at Ohio State.
And that's comforting to know that it's not just something new and that nobody has experience with.
Yeah.
Well, I want to really thank you for talking about everything with us and letting us come to your beautiful office and,
Oh, I thank you.
and do this and spreading the word about lung cancer and cardiac health both.
Yes.
Your practice, your dad and you and Dr. Roy, you all are so community focused.
Mm-hmm.
I don't think people realize what all you do for the community. And as a person in the community, I want to thank you.
Always thank you.
It makes a big difference. We don't get to have the minority health fair this year. That was something else we all work on together, unfortunately. And it's a huge event, but let's hope for next year.
Yes.
And you guys take all your time and you get your fellow doctors to come. And we have quite a bit of community support here in Springfield, and I don't think people realize it.
Yeah, and I mean, that's really, the original Dr. Neravetla.
Yeah.
And that's really his tradition, is has always been steeped in the community and big about giving back to the community, and has been really active in that. And despite the fact that the minority health fair didn't go on this year, he's been working on all this community garden project stuff that I'm not sure if you're familiar with. But,
no, tell us a little bit better.
So he's been working on these community gardens where, there's a lot of food deserts that we talk about.
Absolutely, yes.
And apologies to the boss in advance because I feel like this should be really his story to tell. But
we'll get him on eventually and do that.
But there's these food deserts, and I know we've talked about with the Kroger going out in that area and all that stuff. So they have been in the process of and already have acquired some land that's been donated where they're doing community gardens where they're growing produce and vegetables and so that there'll be access to fruits and vegetables locally that people can walk up and
that's fabulous.
Yeah, so they've been putting a lot of work into the community gardens, and he's even been out there gardening in the community gardens. So he was talking about how quickly the kale came up. So it's just something that's been, it's kind of, being a Neravetla is about giving back to the community.
That's right.
And it's an important part of, what we feel, we owe the community.
Well, we're fortunate to have you here and keep you here for as long as we can. Well, thanks again for being on the program, and next time you have something, we'll be glad to have you back on and
Absolutely.
Get your dad on too. And behind me is the Salt Kills.
Yes, definitely.
Which is another crusade of his, which is huge.
Definitely.
And
very important.
It is important. Very.
And I'm glad that you mentioned that, actually, because I should have mentioned something about that. Is when we were talking about COVID, and that is another concern, is COVID has been an excuse for people to kind of eat junk food, right?
Right, because you're at home. What are you going to do?
Right, and it's really important to try to curtail that, and really work on that, and actually use COVID as a time to start getting creative about your cooking.
Right,
and
eat healthier.
Eat healthier, yes, and avoid the junk food, and really start watching the sodium on the labels, and cut out the canned goods and all that stuff, because that is something that we've seen. It's been one or the other, where people have either, gotten into the kitchen, got passionate, and gotten this drive to get healthy, and with their exercise programs at home and eating healthy, or it's the other extreme where they're like, okay, let's just get a bunch of
snacks,
because it is overwhelming. It really is, and especially for those who are balancing kids at home and all this other stuff. I mean, it can be
and working from home or whatever.
It can be really challenging, but every once in a while I try to post a healthy recipe on our Facebook page, which I haven't done in a little while, but I'm a testament to the fact that you can have a long day but still pull together something healthy pretty quickly. You just have to learn some smart substitutions.
Right, some techniques, and just do it. Don't be afraid.
Yeah, and maybe we can do that another day. Just talk
that
about
would be great.
Some healthy cooking.
That would be wonderful. I'm going to hold you to that. That would be good.
But for this video, my hope to you listeners is that you'll wear white at least once during the month of November.
And I forgot my pearls. Pearls is it too. I usually wear them.
Yes. So it's an excuse to wear white after Labor Day.
It is, that's right. Anything goes.
Anything goes.
Thank you very much again. And until next time, thanks for watching A Conversation with Villa Springfield. And thank you, Dr. Neravetla. And we'll talk soon.
Thanks, Michelle.
Sure.